We have another type of incision which we're going to be doing corner stitch, which is called a 4-point corner stitch. And this is used for certain types of surgery, and we're going to do it here with a straight 90-degree angle, although it doesn't necessarily have to be. Okay, again here we can undermine. Okay, that tip is pretty clear, that tip is fine there. Make sure this area is good. And we're doing the same sort of approach that we did before. We're going to be going through into the dermis, staying in the dermis all the way through, and never going below the dermal layer. So here I'm going to go to the free side that is not cut, go up about 1/8 of an inch, stay fairly close to the midline, push through the skin again, come out in the dermis. And here you can see it came out almost right at the bottom of the dermis. I can either back this up a little bit, come out a little higher if I want to. Okay, that's a little high. Let's back her up again, see where it can come through the center here. Okay, came through about the middle of the dermis here. Okay, same sort of thing that we did with the 3-point corner stitch. I pull through, I do each side separately. I support that tip. It's fine, go through about the middle of the dermis, push through. Came out, you see at the middle right there on this side as well. Remember, wherever you come out of one side at that depth, you have to make sure that you go into your next tip at that same depth. If you change your depths, you're going to run into problems. And make sure it's directly opposite where the other one was too. That's also going to be a factor. So we're going to go on the side here, pop through. Out the other side, came out the middle on this side as well. Again, it doesn't necessarily have to be the middle, but just make sure that the sides are always the same depths. Once I come through here, I'm going to go back again so I see where I line up across there. I want to grab my skin on the other side at that same point, mark my spot, and I usually just kind of push the needle against the skin to line up to make sure I'm in the right location, and then I push after I push it back down nice and level. So here we go again for the 4-point corner stitch in the same sort of scenario again. 2, 3 wraps across. I'm going to pull this direction, just snug it up so it's tight. No real pressure on this one. Single wrap, pull back across, go here, cut my lines. Again, I'm looking for about 1/8 of an inch to 3/16. That's about what I'm shooting for. And you can see the tip is supported, held in place, not everted, not elevated, not pushed down a little bit, nice and smooth, and I finish closing off this 4-point corner stitch with simple interrupted, same as with the 3-point stitch.